Again, even regardless of what it looks like and what we think, this is something that we are always going to evaluate and determine what that is. So we're going to go through all of the Nevis here. So there are some of the individual ones that are going to be when we're born, develop over the time through childhood, all the way up into adults. And so it's one of those things for us to just look at and observe. As I said, this is benign, right? So this is our Nevis cells that are forming of the moles to get that done. These are of the larger stuff. It doesn't have any of the dendrites, and it has more of the cytoplasm. It contains of those granules. So these are just the definition of what these things are, okay? Again, we know that with all of these things, if we are evaluating, if we're looking it over, we always have to think about the A, B, C, D, E's, right? So this is us to just have to look at these things. All of the A, B, C, D, E is important, and that'll be some of the things that will be tested. So here they are, right? This is a common thing. It can start off at a size, and then it can get larger if it's of a pregnancy. If we're growing up, then it can do these things. If this were to start as an infant, as you get older and you grow, then of the moles, it can do that exact same thing. So as of your skin and everything is getting larger, then of the moles can do that the same thing. These things can be anywhere, okay? Yes, they are growing. It gets some darkerness if it is having some of the sun exposure, but this can just essentially be anywhere. With these things, you can see how they are circumscribed, right? So it's all sharply how it looks. It's uniform, right? So it's going to be one of the color width of a mole. It's not going to look like the SCC, of the BCC, and of the AK that we talked about yesterday, where it's all of the different colors surrounding that there. It's not like that, okay? Single, or you can have them all over your body. Multiple. The size, again, it can start small, it can get larger as all of the skin gets larger, but it all, it varies, okay? Diagnosis of that, how do we prove that this is a benign thing, regardless of what it is? We can do a test on that. We can do a biopsy, send it out to the lab, and show everybody that it is only the Nevis cells that are in there, not of the cancerous sites. Treatment, we do not have to do anything, right? It's of a mole. If you do not like it because it's not beautiful on your body, then you can have it removed, but I would send you over to Dr. Pipple so that she can take it off, and I'm not going to take it off because it doesn't mean anything. Again, if they're having a large amount of those things, once you see them for the first time and you do some of the testing on that, then you could see them back annually or up until it's starting to look more as it is not benign. So we think about those things. So what are some of the types of these Nevis? So there are 3 of those: junction, compound, and dermal. So we're going to go through all of these things here. We talked about the fact that some of these you would be born with, right? So of an infant comes out, mom sees a Mongolian spot. What is wrong with my baby? You know, that type of stuff. So these happen anytime after birth or with birth. This is what of the three things look like. So we've got of the junctional, of the compound, and of the dermal. Junctional, flat, it could be a little bit of an elevation, whereas that then can describe what of a compound is like, right? So it gets more up into of a dome, and then dermal likes to, or is pedunculated, the polyploid, and warty is how it looks. So let's break them all down individually. As we said, of the junctional, that is flat or slightly elevated, light brown to brown black with uniform pigmentation. So it's uniform. How it looks is how it looks all over. Size, it varies, okay, but usually it is less than of the 0.1 up until 0.6 of the centimeter. This is all in of the epidermis and of that epidermal to dermal of the junction. So it's right in there. Most common in childhood. That occurs right after age 2, and then as it's growing in age, this can later be of a compound. So it starts as a junctional, and then it can become of a compound, which you can see with all of the pictures here. Of the junctional is slightly elevated, dome, throughout of the three things. So they can develop into those. This is just breaking them down to how they start off. So there you go. That one is obviously slightly elevated. That one is flat. Flat again. So those are of the junctional ones. Let's think about those. Flat, slightly elevated. Compound, more of the elevated. Dome-shaped, smooth, or of a warty surface, with or without hair. So you can either have one that is having the hair follicle area that is having that to bring it out. Uniformly round, oval, and symmetric. These can also be of a halo, which we're going to be talking about here in a bit. So a halo nevus is a compound nevus. It is also there of the dermo epidermal and upper dermis. Chart again shows of the differences in all of these. I think if you were to know this diagram, then that would show you exactly what it is that you are looking at. So there it is, elevated. That does look like it has some of the hair coming out of it. So it's with or without. The dermal. So it's most commonly of a dome shape. However, we talked about earlier how it can be pedunculated, how it can be the warty stuff coming out. Skin color to brown black with hair. So the one prior to this of the compound is with or without hair, but this one here has hair in it. It's common in adults, not so much with the children that we talked about earlier. All of these cells is in the dermis. It can be even all the way down into the fat cells. So dermal means, yeah, it's in the dermis. There you go. On to the right aspect of the lateral eye area. Yeah, eye area. It's not on an eye. Pedunculated. All right. So those are the three of the broad spectrum ones, right? So it's of those areas there. Now let's break them down, which will be some of one of those three things. So, of a birthmark, I'm sure most individuals are born with one of those things. They could stay or they could go. As you get older, they can fade away. And this old man standing up here knows that that happens, because I had one when I was born and it's been gone. All right, found at birth, 1 to 6% of all of the newborns have of a birthmark that is there. It can vary from size, so it can be super small, and then it can be larger. We talked about it earlier, like if you are born with one that's small, as your skin and all of your bones and muscles and everything is growing you up, that can enlarge of the birthmark that you have. Greater risk if greater than 5% of the body surface area or over of the 20 centimeters could do that. I talked about the growing with age. Management, so if it's small or medium, then we're going to observe it for some of the transformation. Is it changing in size and color? Are the pigmentations swapping just back and forth? That would us to biopsy, refer, or to just monitor. Again, small or medium, these things will be cosmetic. So if that individual is growing up and they've never liked it, they were made fun of as a kid, then they want it gone, then okay, yes. But we don't need to, but only if you want us to. If it's large or giant, then we would take that out. So that's what they can look like. I had of a cousin who had one, and it was on that area right there. So she was born with that, and then as she was getting older, the dermatology treatments had to go away. She still has like a scar there, but it doesn't look like it looked way back when she was young. So that's one there. These are ones. You can see how they were born with them, but they could have that for life, as seen this one right here. Congenital. Now let's get into the nevus spillis. So this is of a speckled that would occur. It is the most common in adolescence, at birth, or in early infancy. This will occur in both of the male and female born ones. Hairless, okay? It is oval, or it would be irregular shaped of a brown macule. So it can be dotted with the darker brown or black the papular spots. So it's not just going to look like it's flat and it's just of one color. It can be multiple areas of spots. Where could this be at? It could be anywhere. Okay, it's not just because of some sun exposure. This could be located in all of the covered areas. If you see this one, it is pretty much non-malignant, but again, It's always us to consider these things or to roll them out. Let's look at these pictures. We can easily see why of the term of the speckled, because you have all of the specks throughout of the mole that will show you those. This one right here is not a true one, but for some individual who wanted to have a positive history of making a term and in of a textbook that makes them famous, calls this one of a Becker's. It's not true again because it doesn't have any of the cells, but it does look just like of a mole, and so that's the reason why it was put into of the textbooks. Usually develops in the adolescent men. This could be either of a brown macule, a patch of hair, or both. So we're either just going to see that it's of a macule, or it could be, just covered up by all of the hair, or it's actually just making more of the hair in this of a location. Locations, it's most commonly the upper back, and it's only unilateral. Like it's not just going to distribute throughout those things. It's not of a dermatome, but it would look like the stuff of dermatome, which we spoke about in the past. And the only reason why I'm saying that is because it's not going to be bilateral. It's only going to be unilateral. So back, shoulder, upper arm, sub-mammary, so up and under. Malignant, this has never been reported. Again, you will see these things only if an adolescent male or their parent brings them in and says, why is this growing hair and looking like this? So you're going to go through that stuff. If it's too large, then we will remove that of the mole and try to take that out. Otherwise, we could just shave off the hair as if it is of a normal leg that we need to have that there. If it's really severe and the cosmetic aspect is very high, then we can also laser it. So they look like that. You can see how it is unilateral. The macule of the mole is all up and underneath, but it's producing some of the skin or of the hair out at that area as well. That is of the arm. Located unilateral over here. Again, this is not of a dermatomal, but I just point that out because of the fact how it looks like it's not everywhere. It's only of the macule on one spot. Most commonly, this does take place in all of the males, but it can also be on some females. Again, it's not like it doesn't happen to females very often, but we would not just roll it on out. So that is of the macule there in the picture of the breast. So let's talk about the halo. Halo is easy to see because of the fact that it's got of the hypo of the pigmentation around that of a mole. Okay, it's different from the vitiligo because the vitiligo does not have of a mole into it, but here it is halo, but it's got of the mole inside of it. It is that of the dermal venidus that having some of the white border outside of that. Typically it occurs around the age of 15. This could be setting of the standard of that hypo of the pigmented area. It is not vitiligo, but it could say that in of the future, because you are able to have of the hypopigmentation with one of the moles, it could lead in to vitiligo. It's unlikely, but it could happen. One or more of the hypopigmented to white lesions that contain central red-brown. Central, so it's right smack in the middle. We've got occurrence there over of a decade or more. It's most commonly on of our trunk, and this is not one of the things if you were to see on of the palms and soles. It is not this one, okay? Because this one is never on those areas, okay? Treatment with all of benign stuff doesn't have to happen, but if those individuals are asking for those things, then yes, we would have some of the things to do. If we were to see these things, then we could use the woods lamp to find some other locations that may or may not have the mole, but yeah, if we need to look for that, we could use those things. So here you go. Again, it's all centralized, right? That of a mole is smack in the middle, and then of the halo is all up and around. Some more of these. So these are what of the halos look like. Again, it is not vitiligo if it has of a mole inside of it in the central aspect. All right, so spits, benign juvenile melanoma. So it's there, what is it? And could it be something bad? Occurs most commonly inside of the children, which is calling the juvenile one. But it could also happen in adults. Where we see these things, that would be on the head, neck, and lower extremities are those areas where these will be located. Hairless, red or reddish brown, dome-shaped papules and nodules, the size of 0.3 up until 1.5, and often appear suddenly. So it's not like it was there, it just jumps out, and here we go, off we fly. Remove it just so that we can see of the pathological. Okay, so we're going to lab that one. So that's the spits. Next is of the blue. Slightly elevated, round, regular venidus. Usually that is of a smaller one, so it's less than the 5 millimeter. Large amount of pigment that is into of the dermis, and it doesn't need to be any of a race or of ethnicity. This can happen with us all. Most common on of extremities and of the dorsal aspect of the hands. Oftentimes we can think that this might be some of a melanoma, which we will be testing everything that we see that looks abnormal. This is just another one of those things that we would look at. Cosmetic. If the patient's asked, then okay, we can either take it out or send you to derm, or to have you go to some specialty clinic that treats cosmetic stuff. This is some of the things that they will look like. It's almost like, did you get some cryo on that? And we don't know what it is because it's blue, just like what we were talking about earlier. Blue. Now we talked about the fact that oftentimes we can have some of the infants born that have some concerns from one of the parents. Well, we can see this with Mongolian spots. Usually these are some of the blue to black of the melanocytes. This is more of a flat thing that is just seen. Usually this will be of the pre-sacral area, but it can also occur on of the scalp. If it's going to be anywhere else that is not common, we can see that on of the hands, of the face, and of the trunk. As I said, things that could cause of a mom or of a father wondering, we would see this at birth, and it'll last through into of the childhood. Eventually, this will all fade away. Most common, these spots are seen of the Asians and of the Africans. This is all the pigmentation, right? So that could be blotchy, it could be macular, and again, it's blue, black, or gray of the skin of the pigmentation. The buttocks or the back, no treatment is needed. As I said, once that infant is growing up and getting older, then it will fade away. Again, if you are a pediatrician and you see something like this and it's not a baby that was just born days ago, if this is still on a 2-year-old and you've not ever seen them, okay, well, is this some child abuse that is happening back here? Is this something that I would have to investigate? But you could ask the parents, no, they were fine with that. It's what they look like there. It's right over of the sacral area, so it's on over of the spinal area. Blue to black is what's seen. Again, did you get spanked? Not with a belt, but you got like a brick or thrown at the wall or something? Like, what happened? All right. Nevus of Ota, okay? This is located on the first and of the second branch of the trigeminal nerve, right? So we're going 1, 2. So it's over the eye or it's under the eye. Blue to black of the pigmentation there, okay? This can also affect some of the eye, right? So we could be having some conjunctiva, we can have some sclera abnormalities, just because of the fact that it's all around there. Though it can have some of those symptoms, this is not going to do anything wrong with the vision acuity. Occur at birth or later, and it can be darkened with the age. Commonly, it's Asian females, right? So that can be seen there. Treatment, laser to lighten it, and then monitor of the patient. Because it's the eye, we always want to follow up checking out the eye. Are they having some of the abnormalities that all of y'all have learned throughout HENT when your specialist was over here showing you? So we can see this is all of the lower eyelid area, so we can see that's on of the cheek, nose, in those areas. Again, we can laser this to take it away. Some of the females there, little ones. All right. Here are the last two that are just breaking them down into what they are. So we have the labial melon macule, brown to black macules on of the lower lip. It's not on the upper, it's on the lower. Common in young adult women. It would look like something that is of a freckle, but there is no of a change in that if they're having some of the sun exposure. Again, benign, we can cryo or laser it if it is asked for. Young adult women will probably ask for it to be removed, or let them know. Use some good lipstick. Port wine stain, last one. This is not of a nevus, but this is what we're talking about. This is of a vascular of a malformation. Okay. This one right here commonly involve the face and of the neck, which you can see there of the female. She has that all on of her left side of her face. So it's of her nose, cheeks, upper, so it's all there. Okay? Again, this was all benign stuff. We talked about the three, the junction of the compound and of the dermal, and then we broke it down into the special spots that are into those areas. Okay. Any questions about the benign of Nevi that we just discussed? All right. Should have started this at like 9 o'clock.